I'm John Hurst. I'm a doctor and I'm a lung specialist, consultant respiratory physician working at the Royal Free Hospital here in Camden. Although, as you know, we work very closely in Camden, so I've got very close links with the Camden Community Services who put together these series of recordings. We've been working in Camden now for about 12 years, from Lancashire originally, as you might be able to detect from my accent, and I went to medical school in Scotland, but London's my home now really, so I'm pleased to be talking to you today. What is an exacerbation of COPD? That's a simple question, but actually it's quite a difficult question to answer. Fundamentally, an exacerbation is a change in someone's symptoms. They're more breathless, or they have more cough or more phlegm. The problem here is that people's symptoms can vary a little bit from day to day. People with COPD describe good days and bad days. An exacerbation is not just a bad day. It's more than that. It's a sustained change in those symptoms. These are almost always due to infection, with viruses or with bacteria. Detecting them is important because we know that exacerbations are a major contributor to ill health in people living with COPD. The question of how to know when you're having an exacerbation is really important and actually not easy. But I think the secret to that is having a good understanding of what your own symptoms are like on a day-to-day basis. People with COPD are very different. No two people are the same, no two people are affected in the same way. But in general, although there may be some variation from day to day, people's level of breathlessness is generally the same. People's level of cough and phlegm, generally the same. And so an exacerbation is really when you have a change in those symptoms that's more than just a bad day. And if you do that, that's a time to ask for help. What to do if you're having an exacerbation? The first thing, don't panic. Second thing, think about where you're going to get some advice and help. And I'd really encourage everybody watching this to do that now, when you're well, and not to leave that until you're unwell. So that if you do develop a chest infection, if you do develop an exacerbation, you already have a plan that you can put into action. And if things are building up slowly and you're not too bad, then maybe you can get some advice from your GP who knows you best and knows you well. NHS 111 is a source of generic advice that might be helpful too. And for some patients, they have access to specialist community teams like the one that we have here in Camden. Of course, if you're really unwell, things are happening very suddenly, if you're very poorly, then call 999. It's the right thing to do if you're seriously unwell. One of the reasons speaking with a clinician is important if you think you have an exacerbation is that there are many other things that can feel the same as exacerbation but are not. For example, pneumonia, or build-up of fluid on the lung because the heart isn't pumping strongly, or perhaps a blood clot. And unless we think about those things and sometimes indeed do tests to make sure that that's not what's happening, we're never really sure that that is an exacerbation. So if you're worried, particularly if it feels different from any exacerbations that you've had before, that really should prompt a discussion with your clinical team, GP, NHS 111, community services, or in emergency, of course, A&E.